Being a paramedic, you have a chance to get out there in the community and save people.
Open your eyes.
Where's Mum?
They're in their darkest hour and they just hand you all their trust and say, here, you help us.
Our priority is just to make sure that you're okay.
Really enjoy going to someone and turning that frown upside down.
Give me a big smile.
We've got you.
Delivering a patient to hospital in a better state than what they were in is phenomenal.
He'll be all right.
Mum, I love you.
They're like angels.
That's it.
There you go. Wake up.
Being a paramedic has taught me life is precious and you shouldn't take a second for granted.
We're going to intubate this person.
After a heart has stopped,
Rock uranium in.
Leonard performs a high-risk procedure.
You just hope that all that training and all that study is going to work out or the patient dies.
Going further down. Has she gone over that bridge?
Yes.
A young mum is badly injured in a catastrophic car accident.
Oh, jeez.
It's major significant force, so potential head injuries, spinal injuries, chest injuries and abdominal injuries.
You've fallen a long way. How's your balls feel, mate?
And a 20-year-old is hit with excruciating pain that could have dire consequences.
If this is in fact testicular torsion, it could go on to affect his fertility later in life.
Emergency services.
Right.
Okay, tell me exactly what's happened.
Stop breathing.
A karate training session has taken a horrific turn for a 46-year-old male.
He was doing exercises. We've done chest compression, quite a bit of stuff.
Okay, if you can turn him on his side, clean out the mouth and nose. Is he awake?
No.
Is he breathing?
No.
Okay, I've already got help sent out for you there, okay? I need you to stay on the line, okay?
The patient is given the highest priority.
Micah 30 received, priority 0.
Paramedics Leonard and Cullen are immediately dispatched. Leonard recently qualified to be a mobile intensive care ambulance paramedic, known as Micah, after years of specialised training.
Suspected cardiac arrest.
Roger.
So, you know, this is what Micah's all about, isn't it?
Yeah, well, it's game on this job. Being a Micah paramedic has been a lifelong dream for me. It's a pressure that I haven't felt before, but it's very rewarding at the same time. You're helping people in their darkest days.
No guarantees with jobs like this. Absolutely.
This is the most serious job that a Micah paramedic or any paramedic will attend. When a patient is in cardiac arrest, their heart has stopped pumping and they're not getting oxygen to their brain or their vital organs. And within minutes, the patient can die.
I've also organised the fire brigade that can help with these situations, so they might arrive first, okay?
Stay with it.
Now, is there a defibrillator available?
No.
Okay, listen carefully. I'll tell you how to do the resuscitation, okay?
Yep.
Place the heel of your hand on the breastbone of the centre of the chest.
Yes.
Right between the nipples. Put your other hand on top of that. Pump the chest hard and fast, at least twice per second, 5 centimetres deep. We're going to do this until help can take over.
Yep.
We're going at this rate. Count out loud so I can count with you. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
CPR's in progress.
I suppose you'll probably gain our IV access. I'll take...
Yeah, you look up here.
I'll look up
Go
here,
on
mate.
that side, I reckon.
Yeah. I'll just have to be mindful.
The chances of surviving a cardiac arrest are actually pretty low. For every minute that this patient's heart is not beating, there's a 10% less chance of survival. And only 35% of patients leave hospital alive after a cardiac arrest.
I've got a waiver. It's Fireys.
Some karate guys.
We're very lucky that Fireys can attend these cases and perform initial life-saving treatment, including CPR and defibrillation, to try to get the heart beating again.
G'day guys, Colin from the ambulance.
Perform one shot.
Yep. How long to your next changeover?
Probably about another minute.
Yeah. Airway's a bit gurgly, Leonard, so we might need to move this up.
As we arrive, a shock has been delivered by the Fireys, but the patient's heart is not beating, so he's clinically dead at that point in time. And I know straight away we're going to have to give this everything we've got, and even then it might not be enough to save this patient.
RC139, receive code 1.
Paramedics Taz and Erica are also kicking off their shift with a time-critical case.
All right, Erica, looks like we have got a 17-year-old male, hard to breathe. His color is grey. He's not clammy. He does not have asthma. There's a lot to explore.
So many things. Short of breath is such a vague symptom, isn't it?
It is.
You don't have any other information. And it can be really challenging to assess because when someone's acutely short of breath, often they're not able to
give
speak
you a proper
to you
history.
and stuff. But it's all about then getting your clues from your environment.
That's correct.
It makes us put our detective hats on.
That's correct.
Yeah.
Do you think our ambos can be a good detective?
Probably.
Yeah. Something to think about once I hang up my boots.
Yeah.
I'll wait till you retire, and we can open together. Private investigation.
Will you still be around by the time I retire?
Oh, what are you saying?
Taz and I are pretty comfortable around each other. I do like making jokes about how old he is and about his lack of hair. I think, honestly, there's a bit of hair jealousy.
All right.
The mood soon changes as they arrive at the scene. They are only moments behind single responder Blixer, who's listening to the patient's chest after hearing his worrying medical history.
Hey, Blix, how you going?
Can I trouble you to start getting some nebs ready and I'll tell Taz a little bit of a story?
Absolutely. Yep.
This is Ray. Ray's a 72-year-old male who's got a respiratory history, so primarily he's got undiagnosed emphysema. He reckons the last couple of weeks he's been getting progressively worse.
I just had antibiotics from the doctor that ran out 3 days ago.
And why you were taking antibiotics for?
I had fluid on the lungs.
Fluid in the lungs?
Yeah.
Okay.
He's quite tachycardic. He's got a global inspiratory expiratory wheeze.
Okay.
So I think it's probably reasonable that we could treat an exacerbation of COPD.
Yeah.
Back down to hospital.
Yeah. So COPD stands for chronic obstructive pulmonary disease. It's an umbrella term we use for a progressive lung conditions, and it narrows down your airways, making it very hard to breathe. And especially in Ray's condition, where there is a multitude of problems, if not treated, this patient can go into a cardiac arrest or stop breathing.
So how many shocks? One. Yeah, one shock. CPR immediately, I believe, from the other people in the group.
There's really two phases to a cardiac arrest. The first challenge is getting the patient's heart started again. The fire brigade have their defibrillator to deliver a shock to the patient's heart to hopefully enable it to restart again and beat normally. It's pretty much like a reset button on a computer.
All right, one shock. Yep. Stop CPR. He's got a pulse.
Now we've got a pulse, and this is where phase 2 begins.
Pull the AP airway out. Turn your suction on.
We need to protect their airway to ensure that they get as much oxygen to their brain and organs as possible.
Airway's incredibly solid. We'll need suction there. Have you got suction, guys? So how many shocks? One.
We suction the airway to make sure it's clear and then proceed to ventilate the patient with oxygen. We've got the heart beating again, but the patient is not breathing effectively.
He's taking some breaths. I'm going to get one of you fellas to take the airway. Just hold the oxygen on him for the moment.
And we don't know if he's going to have another cardiac arrest in our care. And who knows how much damage has already been done to the organs. If there's been a prolonged amount of time where the brain has been starved of oxygen, that patient may be brain dead.
Hey, mate. Can I get one of you to do a 12-lead ECG on him straight away?
The younger students are sent home, while karate sensei Giovanni remains on site, still reeling from how the night's unfolded.
We're on the ground just doing our back stretches, and as we were lying there, I heard just this weird breathing. As we'd sit up, one of my students was on his knees and keeled over, basically his face on the ground and struggling to breathe.
Sharps away.
So I pulled him up and everything was tense. His neck was tense, his jaw was closed, his eyes were semi-lidded as well, and he then started going blue because his breathing had stopped. 000 was called, the operator guided us through the compressions. I am trained, but yeah, nothing ever quite prepares you to use it in such a serious situation.
Keep just watching his breathing.
He's a really lovely guy and he's really caring. And then seeing him on the ground in the way that he was, nothing ever prepares you to see someone, you know, possibly dying.
going to do is we'll get a little mask on him.
Paramedics Erica, Blexer and Taz are deeply worried about 72-year-old Ray, who's a long sufferer of chronic obstructive pulmonary disease, which can lead to severe narrowing of the airway.
2 lots of salbutamol, both 5 milligrams and 2.5 mils.
Yeah. This patient is struggling to breathe. It's a serious condition, so we knew straight away that we are dealing with a time-critical emergency.
Okay, Ray, this is just to make you breathe a little bit more easy, okay?
Terrific.
We can treat these patients with a nebulizer mask, which converts a liquid medication into vapors, which can relax your airway. So the more oxygen or more airway can get in.
I'm going to pop a little needle in the back of your hand here as well, and I'm going to give you some steroids.
The other type of drug is called corticosteroids. These are the drugs which can reduce the inflammation in your airway.
How's this helping you?
I'm feeling a little bit better, I think.
Yeah.
Probably just another couple minutes worth of this, mate. And these guys will run you up to probably Western General from here, okay?
Okay, thank you very much.
Given Ray's very complex respiratory history, I imagine that his lungs are in fact quite damaged.
We'll get ready to get up onto the chair here and then we'll go onto the bed over there.
Can't go wheelchair there, mate.
No, we don't want you working hard. Okay. I know you can do it, but we don't want you to. Sit your bottom there.
That's it.
Good.
Ray is indeed quite a fragile patient for us.
Well done.
Even the slightest movement in these kind of patients can trigger off their breathing again and make things really difficult, even though we've given medications.
Is that little standing and moving has made the breathing?
Yes.
There. Erica?
Yeah.
Now, this slight movement has made him short of breath.
Yeah, okay. I can hear him wheezing from here, eh?
He's struggling.
Before Taz can put Ray back on the nebulizer mask, he needs to do a couple of quick assessments.
These respiratory patients are very dynamic. They get better and then they can deteriorate again.
I'm gonna attach all those cables again, right? Just to check your breathing.
When that wheeze is produced, this indicates that patient needs immediate treatment. This is a very serious presentation which can lead to a cardiac arrest and a patient can die.
Leonard, I reckon at this stage we're going to need a set of fire or something.
Yes.
Back with the 46-year-old karate student, his heart is beating again. But Leonard and Cullen are concerned about his breathing.
His airway looks relatively clear. I've given him a good suction, so I'm happy at that at the moment.
Even though the patient is breathing, his breathing isn't effective enough to deliver the right amount of oxygen to his brain and organs.
We're going to basically intubate this person.
So we need to take over his breathing and RSI the patient, or rapid sequence intubation, which means that the patient won't have to breathe on their own, but oxygen can be fed directly into his lungs via a tube that ensures the airway stays open.
I'll start setting up my tube gear.
Even though the patient is not conscious, he must be heavily sedated, then given a paralysis drug to avoid the gag reflex, rejecting the tube going down his throat.
I'll start setting up some RSI drugs. I'll quickly drop ketamine.
So we'll go on 100 kilos, Leonard.
Yeah, mate. So 150 of ketamine and 100 of rock.
Yeah.
This is a very dangerous procedure because it's a procedure that involves us putting the patient into an induced coma and then paralysing every muscle in their body, including their breathing muscles. So once we push that paralysing agent, we have only a very small window of opportunity to get a plastic tube into their windpipe.
Okay. Are we attached to oxygen? Everything's there.
If we take more than a few seconds, that patient's oxygen levels are going to plummet dramatically, and if they get too low, that patient will go back into cardiac arrest, and we may not get them back.
All right, I'm ready to go, mate, here.
With me being so new into MICA, it's a procedure that I get nervous about.
Ketamine going in.
Yeah.
Rock uranium in.
Yeah. I'm just going to wait for relaxed jaw tone for optimal intubation conditions. All right, relaxed jaw tone. So taking this off. So entering the oropharynx,
You just hope that all that training and all that study is going to work out or the patient dies.
Erica and Taz are treating 72-year-old Ray, who's still struggling to breathe.
It was all right till I moved.
The situation isn't great. Only a small amount of movement made Ray worse than when we first got there.
But just want to listen to your chest one more time.
Yeah, mate.
If we're not able to manage Ray's condition, ultimately his breathing is going to continue to deteriorate to the point where he'll go into what we call a respiratory arrest. So his ability to breathe will stop.
He's still got widespread respiratory and expiratory ways.
Yeah, okay, yeah.
Look, we can just probably run.
Yeah, I reckon just notify him. We'll
Yeah.
go on a 1 and, yeah, I'm happy with that.
Yeah.
We're not too far from hospital, so, okay.
If Ray panics, it's going to make him breathe a lot quicker and ultimately it can just worsen his condition. So it's super important that we speak to him in a calm tone to help try and control his breathing and remove any anxiety component.
All right, I'll get in the driver's seat.
Yeah. Hey, Ray, I just want to give you a bit more of that nebulizer because that did make you feel a bit better.
We give some further nebulized medications.
Are you ready to go?
Yes.
But essentially now our main role is to get him to the hospital as quick as possible.
All right, he's going to use the sirens a little bit here, guys.
Just a few siren.
I'll only use the siren when it's absolutely necessary, just to minimise the stressful stimulus for Ray.
Is it easier to breathe with that thing going?
It is.
Yeah? Okay.
Yes, it is.
Ray is definitely not out of danger, but we can see that with medication he's feeling better. These patients require a lot of rest and reassurance, so we can give them to calm down. Paramedic job is not just about injections and needles and medications and trauma and blood and gore. I think it's more about communication.
And how many kids you got?
I had 5 and I lost my older daughter through diabetes.
Ah, sorry.
5 years ago.
Sorry to hear that. How old was she?
She died at 45.
Oh.
And then I got 30-year-old twins I had later in life to another marriage.
And you close to them?
Oh, yeah, I'm close to all my kids.
Good.
And then my partner's got 4 boys with kids and everything. It's a big reunion at Christmas.
Oh, yeah. Where do you set up the table?
Well, we set it all up, don't worry about it.
Yeah, sit on the floor, on the grass.
And we bring out their little granddaughter.
Yeah.
She's 10 now, and we've had her for over 6 years. She's a world, eh?
It's good to spend some time with the grandkids, isn't it?
Inside Ray's heart, I think it will be his biggest wish to live as long as possible to enjoy this family. But at the same time, I think he's also concerned about his medical condition.
So we're almost there, right?
Just a few little bumps.
I think Ray will go straight to the resuscitation bed, the acute clinical beds in an emergency department where treatment can be initiated promptly.
Do you feel a little bit more settled with your breathing now, you reckon?
A little bit.
Yeah.
And I hope that with the proper treatment, he can spend as long as possible, time with his family.
Thank you.
Coming up,
Oh, wow.
a young mum's dramatic plunge off a bridge has paramedics racing to get her to hospital.
I'm horrified to see the distance that she has fallen. It really heightens my suspicion about the injuries that she could have sustained.
Going further down, past the bougie.
Intensive care paramedics Cullen and Leonard have paralysed all their karate patients' muscles, including the ones for breathing, so they can feed extra oxygen to his lungs via a tube.
Bend that a little bit, curve it a little bit for me, mate.
Until we pass the tube, the patient isn't breathing. So the longer we take, the longer the patient is being starved of oxygen.
Yep, that's through. And then we'll ventilate.
Once I insert the breathing tube, just because I think I've seen it go into the right hole doesn't necessarily mean it is. So I have to give a few breaths to the patient and watch on my monitor for clear indicators that I have done it successfully.
That's still 99%.
99%.
Confirmed.
Yeah, good job, Leonard.
No worries, mate.
And once I see that his oxygen levels are improving, there's a massive internal sigh of relief.
We're just going to secure things and then we're going to start moving.
We've done it. The patient's airway and breathing is stabilised from here on in.
So, guys, the intubation was successful. Short downtime, and it looked like would have been pretty good CPR from a karate group. So hopefully we'll have a really good outcome.
Ready, set, go. Yep, perfect.
Although we've stabilised the patient and taken full control of their airway, breathing and circulation, the patient's not out of the woods.
Let's move in slowly.
We actually don't know what's the cause of the arrest. And because we don't know, they can re-arrest at any point in time, and that's why it's critical that we get to hospital really fast.
I'm just going to run through the checklist.
Yeah.
So airway's fine, there's no secretions of vomitus that I need to worry about. The tube, it's 23 at the lips.
And we don't want to miss anything. Highly stressful jobs, no matter how experienced you are, you're open to forgetting something because your mind is thinking about 1,800 things at once. So checklists are a lifesaver.
And we've got end titles confirmed, yes. Sats are good still.
As we arrive at hospital, I know that we've given the patient the best chance possible, but that doesn't mean that he's going to have a long-term prospect of survival.
The fight starts now. He's going to end up in intensive care. He's going to be there for a significant amount of time.
Yep.
There's no guarantee that he will wake up, and if he does wake up, we don't know what condition he will be in.
Tell you what, you earn your keep at these jobs, don't you?
Oh, mate.
In Australia, one person is hospitalised every 15 minutes on average due to road accidents.
Check for checks, please.
All set in the back, bud.
Flight paramedic Steve and the air ambulance team are responding to a 23-year-old woman who lost control of her car, swerved off a bridge, landing upside down in a river.
All clear.
The mum got herself out of the wreckage, but doctors at a local hospital immediately requested urgent transport to a specialist burns unit in Melbourne. Mid-flight, a photo comes through of the injuries.
Oh, wow.
From the photo, what I can see is that she sustained some chemical burns from the petrol, and I'm worried about not only the burns to the skin, but also the fact that she may have some airway burns, because any burns of the airway can result in narrowing or occlusion of the airway and ultimately result in death if it's not rectified or addressed quickly.
Helicopter's landing. Landed, yep.
On top of that is the trauma involved. You know, she's gone over a bridge, and the fact that she's climbed out of the vehicle doesn't put my mind at ease. Over the years, I've experienced multiple patients that have managed to get themselves out of horrendous accidents, only to have absolutely horrifying injuries.
Hello. How you going? What's the patient's name?
Paige.
Paige?
She's 23 years of age.
Mhm.
She was driving about 100 k's and she's gone off the Devlin's Bridge.
Oh, right.
And gone into the river. Petrol everywhere in the water. Paige has actually got herself out of the car and got petrol all over the top of her body. She initially had SATs of 88%.
Mhm.
The hospital put her on oxygen. She went up to 99. I took her off the oxygen. She dropped straight back down to
Is that right? Okay.
So I put her on the rebreather and she's 97.
We get some new information stating that her oxygen levels have decreased. Now she's requiring supplementary oxygen, and that concerns me greatly because now I'm starting to wonder just how much damage has been done by the chemical burns. And that's why it's important that we move her to the specialist burns unit as quick as possible.
Eager to provide more information is Paige's sister. Their grandmother has just driven past the accident scene and sent through photos.
Oh, wow. Has she gone over that bridge?
Yes. So they estimate it at about 10 metres. It's all rock on the bottom. They were even struggling just to get the doors open.
Oh, wow.
So I'm not actually sure how she managed to get herself out of the car.
I'm horrified to see the distance that Paige has fallen. It really heightens my suspicion about the injuries that she could have sustained. Not only the burns injury, but on top of that, the major potential head injuries, spinal injuries, chest injuries and abdominal injuries with internal bleeding and so on. So I'll be extremely surprised if she hasn't got something very serious going on.
Emergency services. Okay, tell me exactly what happened.
Okay, so it's my son. He's 20 years old.
Yes.
A worried mother is on the line after her son suddenly doubled over in pain and collapsed on the floor.
All of a sudden he went grey and felt like he wanted to faint, throw up and poo himself all at once. All right. He described it as being punched in the stomach and kicked in the testicles all at once. Okay, so an ambulance is being sent.
Response 99 received code 1.
Intensive care paramedic Cam is racing to the scene.
The thing with abdominal pain is you never quite know what it is. Sometimes it's worth just having a Panadol and seeing if the pain goes away, unless you have a situation where you collapse or you faint and you're pale and you're sweaty. And some of these things can turn out to be quite severe. The abdominal pain is very difficult to diagnose pre-hospital, but we've got so many big organs within the abdomen, you know, it could be a life-threatening condition. Is she going to wave at me? Right. Concerned-looking sister. Hello.
Leading Cam in is Mum Kim, who has not been able to move her son after he fell to the floor in agony.
G'day. My name's Cam. What's your name?
Lucas.
Lucas.
Sister Danica is also horrified to see her brother in such pain.
What's happened to Lucas?
He had a sleepover last night.
Yeah.
He reached out of the door.
Yeah.
All of a sudden, he was standing here and he just went grey and said, "Don't feel well.
Yeah.
I need to sit down. I feel like I'm going to faint.
Yeah.
I feel like I want to vomit. And I feel like I want to put my pants all at once."
Gotcha.
And now he's complaining of severe lower abdomen pain.
Lucas looks pale, sweaty, and these are the body's responses to severe pain, but they also could mean that he might have a bleed in his intestines or in his abdomen. He could be critically unwell.
It's very bad.
Yep.
Paige, it's been a decent fall.
Flight paramedic Steve is preparing 23-year-old Paige to be airlifted to a Melbourne hospital after she smashed through a bridge in a shocking car accident.
I can start some more pain relief and maybe even an infusion and just keep it running.
Local doctors documented chemical burns to her skin, but the worry is she may also have burned her airway.
Being the type of burn it is with a chemical, it's a pain in the backside because it's stuck on you.
Chemical burns are very different to just your flash burns. You need the right chemical basically to wash it off. Now with petrol burns, it's very hard to get petrol out. So there's potential that it's still chewing away or burning away on her skin and her airway, where it can actually continue to swell to the point where it would actually close right over, which ultimately would result in death.
Just the soft collar if we can.
And then on top of that, the fall. So, you know, I'm extremely concerned about the height that she's fallen.
You're moving your limbs, everything looks good, but just looking at the photos of your vehicle, you've fallen a long way.
Yeah.
And when you fall a long way and you're upside down and whatnot, even though you've got pains from the burns, it may be hiding the pain that you have in your neck, OK? So I'm going to pop this little collar around your neck.
One of the things we often talk about are distracting injuries or distracting pain. And given the fact that she's got some burns to her shoulders through chemical burns, that pain might completely overshadow the fact that she has spinal injuries. Now, although it's not presenting at this point in time, swelling around the spinal cord can actually progress to a point where she becomes extremely unwell with neurological deficit or loss of function of her limbs.
What do you do with yourself?
I'm a stay-at-home mum.
How old's your bubs?
She's 4 now.
4? Beautiful.
I wanted to go back and actually do a doctorate so that I could start the sort of pathway to becoming a reproductive endocrinologist.
Oh, goodness me. Gosh. And where were you heading today? You were heading up to see your sister, were you?
Yeah, well, I was going to see my mum who lives in Yale. One of my best friends who lives up there has just had a newborn baby.
All of Paige's family have been notified, including her nan, still at the accident scene with a rescue crew. While Paige's daughter wasn't in the car, her puppy Lilo is yet to be found.
Paige remembered seeing Lilo sitting up there and saying to her, "I've got to get out, but I'll be back for you. I'll be back for you."
It's just the person she is, loving, caring, a wonderful mother. So
to find what we'd found, and I thought, how the hell did she get out of that car?
You're lucky to get out of the vehicle the way you have.
So Paige, I'm just having a conversation, albeit brief so far. I'm just amazed at the kind of person she is. she has a young daughter. And it doesn't change my management, but it certainly highlights the fact that what we need to do for this lady is make sure that we get her to hospital, get her seen to, get her treated so she can get back to her most important role, which is being a mum to her beautiful little daughter.
I need you to keep your head relatively still.
Lucas, I'm just going to check your temperature, mate. Are you a well person normally?
Yes. Back in Melbourne, Cam is investigating why 20-year-old Lucas suddenly collapsed on the floor with severe lower abdominal pain.
Never happened before? No. Did you get sweaty or anything like that?
I can get sweaty.
Yeah. Have you been eating and drinking well of late?
I just had a banana for breakfast.
Do you normally eat bananas?
Yes.
No diabetes, epilepsy, nothing like that?
No.
Can I just have a feel of your tummy?
Yeah.
Yeah. You're sort of guarding your tummy a little bit there.
Yes.
Yeah. Is that hurt when I touch there?
If you go any lower, it would very much so.
Look, he's not running a temperature, and without vomiting and diarrhoea, you start to exclude things such as inflammation like appendicitis, and without a rigid abdo, he's not bleeding within the abdomen, so I think it's more to do with his genitals.
You haven't been hit in the testes or anything like that?
No.
No.
I just got out of bed, I was fine until it just hit blurred vision.
I think the blurred vision and the nausea is probably a response to the pain where your body drops its blood pressure. Has the pain decreased in intensity at all?
No, it's consistent.
Okay.
With the description of the discomfort that he's feeling right down low in his abdomen, I start thinking of testicular torsion as a working diagnosis. Testicular torsion is a twisting of the tubes that go to the testes, and if they are twisted, you can actually kill that testy itself. So if this is in fact testicular torsion, it could go on to affect his fertility later in life.
All right, a little bit bright in the sun, okay?
23-year-old Paige is being airlifted to a Melbourne burns unit.
Just keep your head nice and still. I know it's awkward.
Yeah, good to go.
Her sister will follow behind in her car.
Do you want to quickly say bye? Just keep your head nice and still.
It's okay. I'm going to follow you. I'm going to call everyone, and it's all right.
Lovely. Okay, I'll give you a call once we get down there, mate.
Love you, Paige. I'll see you soon.
Love you.
Paige's mum is devastated she can't be there for her daughter as motor neuron disease keeps her housebound.
I always knew Paige was a strong girl from the day she was born. Very big personality and you could say stubborn. So it didn't really surprise me that she got out of that car. But every time Paige has been sick or something has needed to go to hospital, and I've always slept beside her hospital bed. So as a mum, not being well and even being able to drive just to see her is torture. Yeah, torture.
So you don't feel sick in the tummy at the moment?
No.
No? Okay, you've had a medication to stop you from feeling sick.
Yeah.
But from what I hear, you had a bit of a vomit. Just going to keep that oxygen flowing, okay, just at a low level.
So prior to takeoff, we've assessed Paige's airway, and although it looks open, I am concerned about the fact that she has vomited. So I'm just watching that monitor to see if the oxygen levels are dropping.
All set in the back, bud. Takeoff fresh.
There's still the potential that her airway starts to swell, and during flight, if it does deteriorate, my opportunity to intervene is lessened. So it would be an assessment based on time frame to hospital or landing as to whether or not anything would be performed in flight.
Hi.
Lucas, this is Kat.
A second paramedic crew has arrived to help Cam transport 20-year-old Lucas to hospital.
Lucas is normally a very well young man. No past history, no meds, no allergies. Had a few friends over for a sleepover last night. Everybody ate and drank normally. They all got up and left this morning. He's had a banana and felt a sudden onset of severe lower abdominal pain just above his groin there, non-radiating.
Mum Kim and sister Danica witnessed the event and called an ambulance straight away.
Given where the pain is, a hot spot for testicular pain, I think worst case is we treat it as torsion for the moment.
Take you up to the hospital.
Yeah.
Let them have a good look at you.
What do you think of methox? What do you want to do? Yeah. Methoxyfluorine.
Lucas is a sturgy science student.
Yeah. It's an inhalation anaesthetic agent that will dissociate you from the pain.
Lucas is in a lot of discomfort and distress. So my first priority is to give him some pain relief.
Little breaths.
And I give him the green whistle, which is methoxyfluorine, just to try and take the edge off the pain and get him feeling more comfortable to move out to the stretcher.
Lucas, can you sit up now? Go for it, mate. I've got an ambulance stretcher just outside the door. And
Necessary though, going to the ambulance to the hospital.
How's your balls feel, mate? How's your gut feel?
Doesn't it just go away?
No. The worst case is it could be testicular torsion, which is where a ball has turned and the tubes to the ball have twisted. It can be really dangerous, mate.
Lucas isn't sure. He's worried about all the fuss about himself.
Let's get out.
But if it is in fact testicular torsion, he needs immediate treatment. He needs that tubule straightened up sooner rather than later, otherwise he runs the risk of losing that testy.
Hey, mate.
Dad Theo dropped everything and rushed home from work when he heard what happened.
He's got severe lower abdo pain, testicular pain. We're going to get up to Monash.
This would be scary for any parent, to see a kid collapse, pale, sweaty, severe pain.
Yeah, keep breathing on it the whole time from now, mate.
When they do get to hospital, he'll be seen by a doctor and they'll do some blood tests and some imaging.
He'll be all right.
Our kids are our life.
Yeah, mine are the same. Nobody likes to see their kids sick, so I get it.
Hopefully it's not as severe as testicular torsion, but he needs to go to hospital today to get a definitive diagnosis of what's going on.
We're about 15 minutes off.
As the air ambulance heads to Melbourne, flight paramedic Steve is briefing the Alfred Hospital's trauma team about his patient, Paige.
So, just to quickly run through it, 23-year-old female, she's gone over a bridge straight into a river. When she's come out, the surface of the water's been covered in fuel. It hasn't actually gone up in flame, but she's been exposed to it on her left arm and left shoulder and back of her neck. We've got her collared, she's GCS 15, heart rate's 80. She's sitting at 96%, so generally stable, but she has had a couple of big vomits. What amazes me is just how quickly things can go from just an average day to a horrendous day. For Paige, 1 minute she's dropped her daughter off and just to go visit her mum, and all of a sudden she's gone through some major trauma.
As soon as you can see the city. You guys all sat in the back there?
Yeah, mate, yep.
I started to descend.
And although we, as paramedics, obviously concentrate heavily on the physical injuries that we see, the one aspect that, will require a lot of management for Paige will be the ongoing mental effects of this, the PTSD issues of just driving along country roads.
So, Paige, we've got some lovely doctors and nurses to look after you. So just keep your head nice and still once again, Paige, as we go in.
I'm extremely concerned about her spine and her airway. And the reality is you can't go through a mechanism, what Paige has gone through, without having some ongoing effects, aches and pains in bones. On top of that, mentally challenging. She'll be reliving this story for years, if not her lifetime.
It's been 8 weeks since Leonard and Cullen were called to a cardiac arrest at a karate studio. Only 10% of these patients survive. And while the man was delivered to hospital with a pulse, his long-term prognosis could still go either way. It was 5 days until karate sensei Giovanni got news that his student had been brought out of an induced coma.
The relief came when he woke up, and he was actually quite communicative.
Incredibly, the man suffered no lasting injuries, in large part due to Giovanni starting CPR within 90 seconds. The first responders then did their bit, which explains why Victoria has one of the highest survival rates for cardiac arrest in the world.
Hearing that the patient is expected to make a full recovery gives me such an unbelievable feeling. It's why I decided to become a paramedic. But we can't take all the credit. It was his friends who found him in cardiac arrest. It was his friends who called 000 and performed early CPR. They're heroes. They should be so proud of each other.
It's not every day you're able to help save someone's life, so it's a pretty amazing feeling.
The man is expected to return to training soon, and Giovanni is more ready than ever.
I purchased a whole new first aid kit and we purchased a defibrillator, and I really pray we never have to use it, but it is there if anyone needs it. At the end of the day, if it was to happen again, I wouldn't be able to forgive myself if I didn't get one.
I can hear him wheezing from here, eh?
Yeah.
As for Ray, who struggled to breathe with severe chronic lung disease, a few days in hospital were needed to fight another chest infection. Back home, Ray's feeling much better and has even mowed the lawn. He's hoping advice from a lung specialist will keep him around to spend as much time as possible with his kids and grandkids.
It's very bad.
Yep.
Lucas collapsed on the floor with severe lower abdominal pain. Cam's working diagnosis was testicular torsion, where one of the testes is twisted. The hospital ran all sorts of tests, and fortunately, Lucas did not have the dreaded condition. The cause of the pain could not be explained, but he's back home and fighting fit.
He'll be all right.
And it's been 8 weeks since 23-year-old single mum Paige was airlifted to Melbourne with a whole host of suspected injuries, while her wrecked car was still being searched for her missing puppy.
Lilo! Hi! What are you doing?
Not only was Paige's puppy saved from the wreckage by the CFA rescue crew, but the chemicals that burnt her skin fortunately didn't make it into her airway as feared. There were no broken bones, but Paige ended up receiving treatment for pneumonia and had skin grafts done during her 8-day stay in hospital.
I've got an MRI on Tuesday at 6:30 that we've got to go to.
Paige is staying at her grandma's home while she goes through rehab for the physical and mental scars she is carrying. Daughter Daisy is staying with her dad while she recovers.
I've had a lot of issues with my neck, shoulder, and I struggle to walk 250 to 500 metres without having back spasms.
Returning to the scene of the crash with her best friend Talia, it all seems like an awful dream.
I believe that you went through a bridge.
I hurt physically and I hurt inside. I struggle to get in the car at the moment. It's something that I'm obviously going to have to take some time to work on.
I'm just really grateful that you're alive.
But the doctors and all the family help and friends and just the support in general has been phenomenal. I'll never be grateful enough.